Is it recording? Yep. Ahlan wa sahlan.
Mess around with the gang, once a click, bang. The man I go wow, wow, wow. I don't need a gang, I was all.
That's how you introduce yourself. No, that's how you introduce a video in Arabic. Ahlan wa sahlan. Kayfak? Tamam, alhamdulillah. Anyways, today's video, is not me teaching you Arabic or me talking about how to learn Arabic. It is actually why I don't want to do surgery anymore, which is probably a big shock to everyone, to the whole world, to the dunya. It's mad, okay? So let me tell you why. But before I tell you why, I want to talk to you about the story building up to this. So imagine, sorry. Imagine, I've wanted to do medicine since I was 16. And the reason why I wanted to do medicine was because I wanted to become a surgeon. I didn't want to do medicine and then decide what specialty I wanted to get into. No, I knew I wanted to be a surgeon, and specifically a heart surgeon, before I even decided to do medicine as a degree, okay? So that was it. So whenever people used to ask me, Raihan, what do you want to do when you're older? I want to be a surgeon. I want to be a heart surgeon. That's it, okay? No further questions. That is it. Just heart surgery. It's so. What I used to think, was heart surgery. That's the hardest one that you can get into. It's the coolest one. Like, imagine saying to someone, "You're a heart surgeon." I cut up the heart. I fixed the heart. I break a few hearts. Whatever. Do you know what I mean? Like, all them balls you could be dropping, but I just used to think like heart surgery was the one that I wanted to do. For so many years, even throughout medical school, it was what I wanted to do. And I think the main thing that drew me towards surgery was the fact that it's medicine, it's human biology, it's everything that I enjoy about science, and it's practical. It's not just, you apply your knowledge and you refer to another doctor or another specialist and you prescribe medication. No, it's practical, it's hands-on. Like, I enjoy hands-on things. Like, if you give me a problem with your car, I will want to fix it, okay? It's weird. Like, every time I have a problem with my car, before I take it to the mechanic, I want to know, can I do anything about it? Can I fix it? I want to see what I can do. Do you know what I mean? So medicine, the thing about surgery is it's hands-on, and that's one thing that drew me towards it a lot. Plus the added benefit of, like, a patient comes in, they're ill, they've got life-threatening conditions. So for example, one patient that I saw was a patient who'd been involved in a car crash, had built up pressure in her brain, and essentially what they had to do was drill a hole into her ventricles and relieve some of that pressure. Now, she came in unconscious, probably with not long left to live if she was left like that. Surgeon drilled some holes in, relieved that pressure, and she's back alive. Like, do you know what I mean? You see the progression, you see the work that you've accomplished straight away. So that was why I wanted to do surgery, okay? So hopefully I've probably sold all of you into becoming surgeons, and you're all gonna go away and want to become surgeons. But that's not what this video is about. This video is about why I don't want to do surgery. And obviously, as I decided I want to do surgery, I started attending conferences and stuff. And I attended a conference in my third year, cardiothoracic surgery conference, and I wanted to find out more about the specialty, etc. And at that time, I was also on my clinical placement in a hospital, and I was getting to sort of speak to doctors, speak to surgeons, and like ask them about their specialties and stuff. And you build more information up on the specialty that you're interested in. So this is supposed to be a good thing, but for me, imagine I was at this conference and 3 out of 5 of the speakers started off their presentation by saying, "By the way, I'm divorced," or "By the way, I hate my kids." Now imagine you're at a conference and like they're trying to sell the specialty to you, but that put me off completely. But then I was like, no, you know what, it's okay, it's fine. it's probably just a 3 out of 5 surgeons, you know. It's not a big deal. But the more I asked, the more I found out, the more I realized how time-consuming surgery is. Now, the more doctors I spoke to, the more surgeons I spoke to, the more they said, yes, it does take up your life. Yes, you will have to sacrifice a lot of your family life, but it is manageable. Now, don't get me wrong, I've met doctors who still love their wife, who still are married, who still love their kids. It's possible. You just have to be good at balancing your time. But for majority of cardiothoracic surgeons, you will find, yeah, they do have a struggle with balancing this. And that is what essentially put me off surgery as a whole, because you know, you have to keep your phone on. You can't keep your phone on silent. You will get a call sometime during the night. Come in, we need your help, we have a patient. Okay, like this was something that really put me off. Now for me, I really value family life. I really value my hobbies outside of medicine, so YouTube being one of them, but plenty of things that I really value in my spare time. And a career in surgery is what will potentially limit me from carrying on with these things. And although I love medicine, although I love human biology, although I love making a difference, helping people out, I don't want medicine to be 90% of my identity, or, you know, 90% of my time consumption. Like, I do want other things going on in my life, you know, like I don't want to just be known as the cardiothoracic surgeon or whatever. Like, I want other things in my life which I want to accomplish. So that is what sort of started to put me off. Now, that was the initial phase. Then I started to speak to more surgeons and, you know, like doctors and like trying to find out about other specialties. And then I realized, you know what, I guess I can't do surgery, but there are other specialties which I can consider. So this is what I'm sort of looking into now. And it's sad because I still love surgery. Like, you don't understand when you have a love for surgery, yeah, you'll see what it's like to sort of, it's like, you know, like, have you ever said goodbye to someone that you know you'll never see them again, but you still want to see them again, like because they're from a different country, you'll probably never cross paths again, but you really like them as a person, sort of thing. It's like that. So I have to bid farewell to surgery. I can never be friends with you again, but I still want to, sort of thing. So every time I'm in theatre now as a medical student, it's like a little bit of a teaser, like, yeah, this is what you could have had, but you can't now, because you left this life ain't for you, sort of thing. But yeah, I still love surgery. Every time I'm in theatre, I just think, oh, why is this so hard? But I guess it's fine. Like, you have to make some sacrifices. Now, yesterday, however, I did come across an intensive care doctor who then opened up my mind and said, look, within surgery, there's different specialties. And then those specialties have different levels of hours that you have to work or shifts that you have to put in. And that then made me realize you're right. He said, for example, a pediatric ENT surgeon in a district general hospital might not be as busy or might not be as consumed with his job as a cardiothoracic surgeon in a you know, a busy hospital. So this is something that I'll probably be looking into now. However, I do also have other specialties in mind, which maybe I'll talk about in another video. But yeah, even though I don't want to do surgery, I will be making surgery videos for you guys, because I know there's a lot of you who are interested in surgery. Please don't let this put you off, but do consider everything. I took my opinion of surgery just from what I wanted to take, like the good. So it's a really appealing job. It's practical, it's hands-on, it's, you know, well respected and whatnot, and everyone loves a surgeon, and it's cool to be a surgeon. But there are harsh realities, you know, sleepless nights, missed birthdays, missed family occasions, just generally, divorces possibly, things like this. These are things you do have to take into consideration. So just make sure when you shadow a surgeon, when you shadow a doctor, which with whatever specialty it is, ask them all the right questions. Ask them all the hard questions that you don't want to ask, or like you think it might be too upfront. No, ask them, do you get enough time for your family? Do you enjoy your specialty? Do you have any regrets? These are questions that have to be asked early on, otherwise you will be stuck in a specialty which you don't want to do. And I've met cardiothoracic surgeons 50 years old, 45 years old, saying, yeah, if I could go back to my time in medical school, I wish I chose another specialty. Now, that's just a few people, that's not everyone, so don't get me wrong, that's not everyone. But this is why I make an informed decision, and yeah, that's essentially the aim of this video, and a little update for you guys who are actually interested in my life. So yeah, thanks for watching. Make sure you like, comment and subscribe. I got a lot of videos coming up for you guys, so make sure you subscribe and put the notification bell on, because yeah,